So Margie, can you give us a little bit of background about your expertise in this area?
My background for this comes from a wide range of working with a wide range of athletes, particularly with shoulder instability problems. My passion for a long time now has been working with shoulder instability. In the lead up to an Olympic Games, I worked with an athlete who had recurrent shoulder instability, and managing her up to and through an Olympic Games was a really challenging part of my career. And then I moved back to New Zealand and we looked at doing some active stiffness, looking at tissue stiffness in traumatic instability. And from there have moved into my PhD looking at recurrent instability following a first time traumatic anterior shoulder dislocation. So I think trying to learn more about how to manage shoulder instability and through that now working in New Zealand in a contact sport environment, trying to establish when people are ready to return. I get time frames from surgeons that say, well, you can go back at 6 months. And I see such a wide variety of what can happen at 6 months that actually what we need are some criteria that say, I have adequate strength, adequate power, adequate range of motion, good neuromuscular control, that you're safe to return to sport.
So tell us the reasoning for the course that you've developed now.
So I created these tests in collaboration with some colleagues. We were looking principally at limb symmetry. We tried to replicate what was happening in the ACL literature and tried to, as always, what happens in the shoulder seems to drag along behind what happens in the knee. And there's a multitude of testing for ACL following reconstruction to return to sport, but relatively few tests that you can use in the shoulder. What I wanted to establish was a battery of tests that were reliable, that clinicians could use in the clinic without fancy equipment, that they could grab some weights, grab a stopwatch and put an athlete through a test that would make them functional and meaningful for both clinicians and athletes. So what we've tried to develop is this battery of tests. There are 5 tests that then you can measure and use for limb symmetry, and I think that is incredibly powerful for people to see one side compared to the other when their athlete is ready to return to sport, and powerful for the athlete as well to know that they are recovered.
Great.